Hi, it's Siobhan, one of the journalists up at Manx Radio. Today we're hearing all about two new models of funding for care which will be put before Tynwald at next month's sitting. The Department of Health and Social Care hopes the new models will make the system fairer and more sustainable for those who use it. Currently, most people have to pay for their own social care, with only people who are eligible for income support getting state support towards these costs. Both potential options would incur a huge cost to the taxpayer. If a free personal care model was introduced on the island, it's estimated it would cost government an additional £24.7 million per year if implemented now, £29 million in 5 years, and £47.6 million in 20 years. If a mixed model was introduced, it would cost an additional £8.3 million per year if implemented now, £9.7 million in 5 years, and £15.9 million in 20 years. I sat down for a conversation with Minister for Health and Social Care, Lawrie, who says an increase in cost is coming down the road either way.
Where we're at now is talking about nursing and residential care. We were originally tasked with the independent review of looking at 6 models of care, how you might go around funding it. Ultimately, this is all about, it's not about where care is provided, in the home or in a residential home. It's all about how much should each person individually have to contribute towards their care and how much should be borne by the state, and then all the difficult nuances that come with that. What we're presenting to Tynwald is a result of some of that work, which says we've narrowed it down to 2 options. There's an option which we're calling the mixed model, which is essentially the model they use in Jersey. It's a form of threshold and cap scheme that says everyone has to pay up to a certain amount towards their own care, but beyond that, the state will cover it, and there are means testing exceptions for lower income individuals. The other option we're presenting to Tynwald would be the model they use in Scotland, which is called free personal care, which essentially creates a national care service in the same way that healthcare is not charged for at the point of use. We would move to a model whereby nursing and residential care is not charged for at the point of use. It is paid for through your taxation system in one way or another, and then you just need you access the care that you need at the point that you need it. So broadly speaking, they're the 2 options that we're going to be presenting to Tynwald, and the ask at this stage isn't to pick one. The ask at this stage is to say we need to do a lot more work on these models in terms of what they would look like in an Isle of Man context, how quickly we could roll them out, what the cost would be, how people would individually contribute towards these as well. It's a very complex picture, which is why it's taken so long to do the work. But we're going to Tynwald basically to say, you asked us to look at 6. We've knocked 4 of those out of the park based on public conversations, public engagement, and engagement with Tynwald members. We're down to 2. Please give us the go-ahead to do a lot more work on these 2 so we can then start engaging with the public, probably launching via the government conference in September, to start having that proper public conversation that says these are what the models are going to look like. We are going to end up with one of these 2, so let's engage and figure out which is the best one for the Isle of Man.
So like you say there, we're going to end up with one of these 2. The option of do nothing is kind of not on the table. Why do you think we really need this change, to see this change in the care system on the Isle of Man?
So do nothing is not on the table for the simple reason that the current system is not sustainable in the long term. If you talk to anyone who's ever accessed the care system, they will know, that it's themselves or whether it's through friends or family members, that the financial burden that places on you as an individual and you as a family can be quite significant, and in some cases quite significantly unaffordable. The current system is been described to me by quite a lot of people as simply unfair. And it is unfair. There is no real consistency across the piece as to how people are treated. It doesn't provide enough support, and it is almost a pay-as-you-go system with some government support tacked on the back end. It's grown up organically rather than actually having been designed, if that makes sense. So the reason this is not a do-nothing option is because I think for at least a decade, if not longer, there has been talk about this. The Manx public, at least to me, have been quite clear that this is a problem area that needs to be tackled, and ultimately we have to be treating people fairly. We have to be meeting people's care needs, and at the moment I'm not convinced the current system does that. I think either of these 2 models could do that. I'm personally on the record as saying I think it should be more like the National Health Service. We should all pay in according to our financial means, and then our care needs should be met by the service irrespective of how much money we have in the bank. That's my personal preference. That's what I'll be arguing to Tynwald next month, and I'm hoping Tynwald will endorse the proceeding down the route of looking at both of these models further.
To implement either of these 2 options, the cost will go up exponentially. What do you think the reaction to that from the public's going to be, and how would you justify that jump potentially in cost?
So what's interesting to bear in mind is if you look at those various cost models, the reality is those costs are coming down the road anyway. The question is, should you pay for them, or should we all collectively pay for them? So when you look at the costs that are in the paper that's being presented to Tynwald, some of the graphs, they do show a substantial increase in care need over the next 20 years. It is going to cost tens of millions of pounds. The question is, should that fall on individuals and their families to pay for their own costs, which could be quite substantial? I mean, the thresholded cap system in Jersey, for example, caps cost at around £60,000. £60,000 is a lot of money for anybody to find. And that's the cap model that they're looking at, or that they operate. And so it isn't a case of we can avoid these costs coming down the road. I don't think we can. The question is it fair to ask individuals and their families to pay these costs, or should they be paid for collectively by all of us in the same way that the health service works? And either way, whatever we look at, whichever one of these models we look at, it's going to involve more of those costs being borne by the state, by the taxpayer, and less of those costs being borne by the individual when it comes to them needing it. And that's essentially the principle that we're looking for Tynwald to endorse. And the question really for Tynwald and for the Manx public is, how far down that road do we go?
If these changes are going to be implemented, when will we start to see them?
So it's a complex picture. So if Tynwald endorses this approach in July, we'd like to start the public engagement with the government conference in September. I'd like to think that as part of next year's budget, there'll be some moves and some changes towards moving towards this. We'd like to be able to come back to Tynwald middle of 2024, give or take, with our final. These are of the two options you've asked us to look at. This is what they look like. This is the one we recommend. Hopefully, if they approve that in Tynwald, then middle of next year, we'll be looking at probably early 2025 to start that implementation process, which again, itself may take a number of years.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.